Welcome everybody and happy Tuesday. I'm Dr. Veronique Desaulniers, better known as Dr. V. So one of the questions that comes up a lot, and actually this came up last week when I hosted a live, was what is the goal when it comes to finding that lump in your breast? What do you want to do with it? Is it so important that the lump is gone and then you can feel at peace? Or is the goal just to not be actively cancering? So that's what we're going to be discussing this morning. So first of all, let's talk about finding that lump. There's nothing that's more life-changing than waking up one morning or one evening, laying in bed, or however you find it, and bam, you feel something very unusual in your breast. Now, let's digress a little bit because I want to talk about breast self-exams, because so many of us have never been taught how to do a proper breast self-exam, so we're afraid to touch our breasts. Now, I was fortunate in the sense that my mother had breast cancer, so I was pretty diligent about doing breast exams in the shower, which is not the right way. But nonetheless, both times I was able to find the lump at a fairly early stage. Now, most women, and I'm going to show you this chart here, most women who discover their own lump find it when it's the size of a ping pong ball. That's a woman who is not trained to do a proper breast self-exam. As you get more proficient in doing a breast self-exam, you can actually find a lump that's the size of a pea. Now, My Breast Friend is a training system that has been used by the Mamacare Foundation for over 30 years. This is a silicone breast model that has specific lumps in different areas. It has very nodular tissue on one side, and it teaches you, the whole system teaches you how to do a proper exam. So number one, it teaches you what to feel for, because we have lumpy breasts, right? How do we know what a lump feels like? So when you actually feel what a suspicious lump feels like, and these are replicas of actual tumors that were removed from women's breasts, and you see there's one way down underneath the nipple, then you know what you're looking for, because you will have bumpy tissue in your breast tissue, but a nodule, an unhealthy nodule or lump, is going to feel very different. It's hard, it doesn't move like the rest of your tissue. Secondly, this training system is going to teach you how to feel. Now, when I hand this model over to women, the first thing they do is they start poking in there. You don't poke, but you use the flats of your fingers and you do little circular motions, and you have to go light, medium, and very deep into the model and into your own breast tissue. And then thirdly, where do you feel? It's not just the breast tissue itself, excuse me, but you have to go all the way up into the collarbone area, into the armpit, on the side of the breast, underneath, and then on the chest bone itself, because there's still breast tissue in those areas. Excuse me. So that teaches you, number one, practice very early detection when it comes to finding a breast lump, because that can literally save you life. When you find a lump that's the size of a pea and it hasn't spread, life expectancy is, excuse me, I don't know why I'm losing my voice. Excuse me. Life expectancy is 15 years for 88%. That's pretty impressive. So take the time to discover what your normal breast tissue feels like and what a suspicious lump may feel like. So mybreastfriend.com, you can order the model. It comes with a 20-minute instructional video as well. All right, so you find a lump, and the first thing that you think of is, what am I going to do with this lump? Do I have surgery? Do I do traditional treatments, chemotherapy, radiation? Do I do evidence-based natural medicine? What is my path? Well, whatever your path is, that's for you to decide. And the good news is you don't need to stay in fear, because there is so much information now and about how we can heal our bodies. Remember that cancer is just a symptom. It's not the cause. It's a symptom that your body is telling you that something is out of balance. Now, if you haven't read this book yet, Heal Breast Cancer Naturally, I go through 7 essential steps that will help you understand why you got to the point where your body developed breast cancer. So I talk about nutrition. Essential number 1, let food be your medicine. Essential number 2 is to reduce your toxic exposure. Every single day you have to do something to detox, because no matter how clean your life is or your food is, we're still exposed to toxins as much as we try not to be. Number 3 is to balance your energy, which includes balancing your nerve system, balancing your hormones, balancing your sleep, your exercise. All those things need to be properly balanced in order to ensure proper health. Essential number 4 is the huge one. That's the emotions. That's healing your emotional wounds. That's making sure that what's between your 2 ears is staying calm and sending positive thoughts to every single cell in your body. If you stay in a fight or flight mode, if you have emotional conflict, if you're in unhealthy relationships, if you're not setting boundaries, if you don't love yourself and you have a lot of self-conflict, or you're not forgiving of yourself or forgiving others, those are serious emotional cancers that need to be addressed. So that's essential number 4. Number 5 is dealing with the dental aspect. An unhealthy mouth and unhealthy teeth is going to affect your health and your immune system. Number 6 has to do with all the therapeutic plants and herbs to be able to target the cancer cells, boost your immune system. And lastly, number 7 is practicing very early detection with all kinds of labs and blood tests and scans. Now, speaking of blood tests and labs, on Thursday morning at 11 a.m. Eastern, I'm going to be hosting a master class on which labs are most specific for your healing journey and what do you need to do to monitor that. That's something that I used extensively, and I still do. I still do labs every 6 months. I used to do them every 90 days. Now I'm every 6 months. And it's so important to measure everything from your vitamin D levels, your inflammatory markers, cancer markers. You know, there's specific things that you want to look at. Your glucose levels, your fasting insulin, your HbA1c. All these things to be able to really see where you are, what's happening in your body. So that's kind of a general overview about what you need to do when you find the lump. Now, the big question is, you know, is it so important for me to remove the lump? Do I want to get rid of the lump? Do I want to be quote unquote cancer free? Well, I'll talk about 2 scenarios. The first scenario that I've seen is that many women choose to have the lump removed and to have a mastectomy or have a mastectomy. Sometimes you get to the point where that's very important for you. If the lump is very large, then that may be something that you have to consider based on your discussion with your doctor. You always want to do what's best for you and your health. Now, on the flip side, I have seen women who've done no surgery when it comes to finding a lump, and they allow the body to heal, and the lump will actually start shrinking, and at some point it may even disappear totally. Now, personally, I've never had surgery. In 2004, with the initial breast cancer journey, I did use external method. I used a black salve that helped to rid my body of the tumor. Don't recommend it, but that's what I did at the time. In my second healing journey, I did not do anything like that. Everything was internal, and it went from the size of a small almond to, you know, being totally gone. I also had 4 lymph nodes in my armpit that were inflamed based on an ultrasound report. And the last scans that I've had, all of them are gone except for one, and one became calcified. It became a granuloma, which means basically my body has encased it, and made it hard, so whatever was in there is not filtering out or traveling anywhere in my body. So your body has an amazing ability to heal. So getting rid of that lump is certainly a personal decision, but be aware you can still have a lump and be very, very healthy. I'll give you an example. Dr. Nasha Winters, many of you probably already know her. She was diagnosed with ovarian cancer almost 30 years ago, was stage 4, basically sent home to die. Now she's thriving, and 30 years later, teaching doctors all over the world about naturopathy and oncology. Now she still has a lump on her ovary. She still has some things on her liver, but she's thriving, happy, and healthy. So the goal is not necessarily to just get rid of that tumor. That does not necessarily ensure you're 100% healthy. What ensures your health is that you monitor it and that you follow things like the 7 essentials, and you make sure that your body is staying in balance and that your immune system is strong. Now, the other question that often comes up is, how do I know when I'm cancer-free, right? That's the big, big question. I want to be cancer-free. But really, we have to stop using that word, because I don't believe that we are ever literally cancer-free. And unfortunately, conventional doctors will tell their patients, we don't see anything in the blood work, you don't see anything on the scans, so you are now officially cancer-free, go home and live your life. Now that allows women, unfortunately, to forget about their healing journey, and some of them go back to their old ways, which allowed the cancer to develop in the first place. So what you have to realize is that your body may still be producing circulating tumor cells. It may still have breast cancer stem cells, the baby cancer cells that eventually are responsible for recurrence and metastasis. And even if you've had a PET scan, it will not pick up anything smaller than 4 millimeters. So you may have a teeny tiny tumor that's not picked up anywhere, and so you're still producing circulating tumor cells and stem cells. So that's not to instill fear or worry, but it's for you to be able to recognize that from this point forward, from that turning point when you were diagnosed with cancer, that from that point forward, you get to live a happy and healthy lifestyle. You get to choose things to eat, things to do that will support healing in your body. And there are specific things that you can do to target those circulating tumor cells and to target those breast cancer stem cells. So things as simple as broccoli sprouts, curcumin, making sure your vitamin D levels are optimal, not in the 30s and 40s. You want your vitamin D levels in a much higher range, anywhere from 70 to 100. You want to make sure that you have plenty of iodine in your body. You want to keep your immune system boosted. Things like resveratrol are also very important for killing off those breast cancer stem cells. So there's lots of things that you can do. You can go to our website, breastcancerconqueror.com, and check out breast cancer stem cells, or even in the book I talk about breast cancer stem cells and circulating tumor cells and why it's so important to monitor. So rather than say cancer-free, I use the term no longer actively cancering. So I celebrated, well, I'm still in year 2, basically. Last week we talked about 2-year celebration of not actively cancering. So that means that my ultrasound is clear, my thermography is clear, my blood tests show that my inflammatory markers are low, my blood sugar levels are staying nice and low. I do what we call the RGCC test, or the grease test, once a year now to measure circulating cells, cancer cells in my body. I'm due again in December, but the last one showed I was in the low level, around 2. So everything is great. I also do another test called IVGene, IVYGENE, which looks at cancer DNA methylation in the bloodstream. So it's kind of like a liquid biopsy. It gives you a range to see where you are on the scale as far as actively producing cancer cells or not. So there's lots of things that you can do to stay on top of your health. So remember, getting rid of the lump is not the goal, right? That's just the symptom. You want to get to the root cause of what allowed the cancer to develop in the first place. Healing your body is about a complete transformation. It's about changing everything in your life. It's about a physical, emotional, mental, spiritual transformation, so that what allowed the cancer to develop in the first place, you will not be living that lifestyle anymore. It's a complete transformation, a metamorphosis. That's why I use the proverb, just when the caterpillar thought the world was over, it became a butterfly. And that's what it takes. It's a metamorphosis. It's a transformation. It's not just about the lump. So I will sign off for now. This is Dr. V sending you a big healing heart hug. Mwah! And till next time.